Vaccination is to get ill a little instead of a lot of pathogens entering our body and having a serious disease. It's like doing civil defense training for war. If our body is well trained, when it really happens, we can cope with it very well. That's how vaccination works. Especially smallpox and Black Death had been a problem. And polio these days. Now many types of vaccines are available and prevent many diseases, but you might ask why we have to get vaccinated. Because the loss from this disease is too great, not just for a single person, but for the entire country. So we can prevent much bigger disasters through the cost of increasing immunity to all of us. It's always a measure of cost effectiveness in terms of health aspects. Of course, even though we analyze it in medical care, economists criticize us and say that it is not cost effective. So as you can see here, you can see that tetanus and diphtheria are significantly reduced after getting vaccinated. In fact, washing your hands is so important to avoid getting virus infection. It's best to prevent it, but more active method to prevent it is to get vaccinated rather than washing your hands. So it's better to get vaccinated if it's available. Some people might concern that vaccination can be bad, but I think it's more beneficial to get it than not getting it. But there's one exception. Do you know where the vaccine is grown? We are talking about the vaccines that are already made, but they are originally. I told you that it gives a hint of a virus. But in order to do that, and to use the virus that is almost killed for our body, the virus needs to be propagated. But the virus doesn't propagate around dead organisms. It only propagates in a living organism. Which means it should be put into living organisms. It's a little sad. So people thought, isn't there a living organism which looks like that, but actually alive? They opened the refrigerator and found a thing that were alive but didn't move. You have it too, right? An egg. So we incubate by making a small hole in the egg and injecting the virus. Of course, not amorphous eggs. Eggs that can be real chicks. So they grow it and purify the virus to make non-viable bacteria. This is the inactivated vaccine. We use the non-viable bacteria, which is not entirely killed but diluted and weakened, but there is still a possibility of infection. So these days, only killed vaccines are used. When extracting a virus that can be a vaccine from an egg, it can't be touched too much even though it requires purification. In order to go through a similar experience, then the protein from an egg might be extracted too, right? So for people with an egg allergy, it will cause an allergic reaction before our body builds up the immunity. If this is the case, it's better not to get vaccinated. So far, I've roughly explained viable bacteria and non-viable bacteria. You need to remember that these days, in most cases, killed bacteria, non-viable bacteria, is used. However, if you have any diseases or fever, be careful before getting vaccinated, even if you don't have an egg allergy and want to take COVID-19 vaccination. So it's necessary to listen to patients' medical history before vaccinating. Some people might not know if they are allergic to an egg or might have experienced illness after vaccination. And sometimes you need to educate them. You're going to meet students during volunteering, so I wrote here things to check in advance. And then actually, can we get multiple vaccinations at once? The answer is yes. So even a tiny baby gets multiple shots at once. So TB and things like epidemic parotitis can be injected together, because it's not a lot amount compared to other medicines. And it just needs to be injected in different parts of the body. It's the pharmaceutical company's job to mix it up. However, we need to keep in mind not giving the same vaccine again because the dose will be too much. So please make sure to check the required interval. We need to make sure to check it, but don't need to worry about viral vaccine because it's not used anymore. So please keep in mind that. And the next question would be if it's okay to vaccinate from different companies. Pharmaceutical companies have already found out whether it'll work or not, but actually there are many vaccines compatible. This time, one got vaccinated from a company, but want to find out if it's okay to take this one from this neighborhood. So it's necessary to find out, but diphtheria is an exception, so I wrote that here. We've looked at vaccination and immunity so far. Now then, let me talk a little bit about what's on the WHO website. You can easily understand it once you look through it. Will antibiotics be effective against the coronavirus? I told you already. Antibiotics are medicines to kill germs, not the virus. However, sometimes antibiotics are used for viral infections. Because if the immunity gets too low due to a virus infections, the germs that were already in the body can cause a secondary infection later. Please know that even if the antibiotics which kill germs are used in advance, that doesn't mean that it prevents coronavirus or cure it. And the next is, we often hear about unproven methods to cure flu. I thought it's the case for Korea only, but I found out that on the WHO website as well. So is it really true that adding red pepper powder to soup or food will prevent Corona-19? I guess you already know the answer. It doesn't help preventing it nor curing it. If you like drinking hot soup, you just have it. That's it. The next is about garlics. Garlics are typically used in Eastern countries, but now Western people eat it a lot as well. And actually, we can guess that the smelly part of garlic might have some potential to improve our health. So I recommend it, but the problem is that many of European or Western people can't stand the smell of the raw garlic. And sometimes they even say that they will just give up the benefit of it, but they also heard that garlic is good for immunity. So people might wonder if eating garlic is helpful to prevent Corona-19. The most effective way to take allicin is to eat raw garlic entirely rather than chopping or cooking it. Then you might ask now if it's okay to meet Corona-19 patients and talk after having a lot of whole raw garlics. But the answer is no. It's never been scientifically proven that it helps to prevent coronavirus. We don't know exactly how it works, but you can think that it just helps to improve immunity. So it's not clear to say that it is helpful. And the next is, you might wonder whether there is any approved medicine for preventing Corona-19 or treating people with Corona-19. It depends on the country and the agency. Remdesivir has been approved by the FDA of the United States, but not by the WHO. The President of the United States cured coronavirus with it. Korea also approved to use for treating Corona-19, but WHO didn't. So you need to be aware of it. After that, China declared that they made a vaccine. I think it's been a month or so. But if it really worked, it would have been used a lot all around the world, but we didn't hear anything yet. That means they might have failed to make it. Anyway, I hope it would be made within a half year. So for now, there is no available medicine for coronavirus yet that is approved by WHO. For example, you will see here a bottle of alcohol. This is rubbing alcohol. You might ask if you drink it or apply it to your skin, then it will cure coronavirus. Of course not. It never helps. It actually can be dangerous. And if you drink rubbing alcohol, it can cause a fatal blood system problem, so it's very dangerous. And is it helpful to apply it to your body? The alcohol is just used to disinfect the equipment or instruments. Some people say they use a 1/2000 diluted sodium hypochlorite or solution, but that should be only used for instruments, not for your body. I've once heard that there are people who wonder if it's okay to put baby into washer, but this is ridiculous. It's absolutely dangerous, so be careful about it. These are things about treatment. We also talked about active medical prevention for corona. I hope it can be helpful to what you do in the future. Thank you.